All right, so Sarah's done scaling on this side. She's going to be, right now she's taking intraoral radiographs. So we can only see so much on the surface and with our eyes. What x-rays allow us to do is visualize what's going on underneath the gum line. If there's any evidence of like abscesses or bone loss or even little fractures, and early growths in the jaw can be detected in intraoral. So we always say that about at least 3/4 of the pathology goes underneath the gum line, if not more. Particularly in older dogs that might have a fracture or significant wear on their teeth. A lot of times we'll see subgingival pathology, problems underneath the gum line with x-rays, and we can address them earlier as opposed to waiting until it's a full-on abscess or causing pain or discomfort to your dog. So dental care can range. With intraoral x-ray we can catch pathology and recommend preventive care to try to keep these teeth in place. Treat infection before it becomes a problem and there's a significant enough bone loss there. Or we can even go so far as to doing a root canal, which is a referral process. We get you over to a veterinary dentist that can do the same thing as what they do in human. They root out the canal and put sealants in and protect that tooth and save the tooth. This provides us that opportunity to give better care to our patients. Okay. So I just looked through x-rays. Everything looks really good. Don't have any subgingival problems. Nice healthy roots of all these teeth. We got clear views of all of them. That's important. And all of the bone underneath the teeth, all in good shape. So at this point we're just going to focus on cleaning them up and getting them good polish and making sure we're not leaving any dental tartar there. So I'm going to take some, this is an Explorer probe, and I'm going to go around each individual tooth and just check for pockets and bone levels. Now the x-rays didn't indicate any issues that were blaringly obvious, but this is actually a good example. So there is a little bit of a gap. Every tooth's a little bit different. In humans they got a standard like 2 millimeter. It's kind of deep on a human, but you can see this is just extra gum tissue around this. This is not a pocket, it's just that's extra gum tissue. So I want to feel for any pockets or discrepancies around that tooth, and everything's good there. I'm going to go around all of these teeth. You can see I'm causing a little bit of bleeding. There's a little bit of gingivitis here. So I'm being really gentle with this. It's just the gums are a little bit inflamed. So that could have been a little bit from the ultrasonic scaler, and also what I'm doing here with this probe. So some key areas where we have problems with dogs are in between these premolar teeth. Right here is a good spot. You see how it kind of overlaps. This tooth goes in front of the back end of this one, so they kind of overlap a little bit. Food and tartar, that's almost impossible to brush. So that's why we recommend yearly dentals. The only way you're going to get that out is to scale that out with a either tartar hand scaler or an ultrasonic scaler. And if we've got a pocket there, we can address it early. Same thing on the uppers. So you see this area right where this fourth upper premolar and this first molar meet. This is a common area to get problems. Got a little bit of a pocket there starting to form, I feel like. This is a really common place to get issues. And this is where he was carrying the majority of his tartar, was right on these big teeth here. A lot of times we'll come in here and the only complaint we'll have on physical exam in an exam room is odor coming from the mouth. And so we'll come back in here and all of these teeth will be just fine, and we'll get way back in here on these last molars here, and they'll just be loose and wiggling, and they're abscessed teeth they're so infected they're causing that odor to form. So that's another reason why to get those annual dentals. I'm just going to go around each of these teeth. Make sure I don't feel anything here.